Hi, I'm Sam, and I just wanted to take a moment to talk about Turner syndrome, which I just so happen to have. It's a chromosomal disorder where either the secondary chromosome is either totally deleted or partially deleted. And it's a condition that only affects females, and it's kind of a tough one to deal with sometimes, because like a lot of stuff comes up with it. There's a lot of health issues, and other things that females that are born with this condition have to deal with. Short stature, infertility are usually two of the most like common factors with Turner syndrome. And I was diagnosed myself personally at birth. For the doctor that delivered me, she noticed that I had puffy hands and feet. Sent out a karyotype, which came back positive for Turner syndrome. And my mom, she probably told me when I was very young, probably like in preschool, that I had it. So Turner syndrome was just always a normal part of my life for me, which I'm grateful for. I would definitely recommend to any parents of daughters that have Turner syndrome, like, tell them right away. Tell them as soon as you can. Like, don't wait. Like, definitely do not do that, because there's never going to be a good or right time to tell the person. And it's a condition that's going to affect her whole life, you know? And the more you know, the better off you are. And I do realize that for myself personally, I feel like that having known from such a young age helped with my ability to be able to cope and handle it, because I wasn't treated any differently, anything like that, compared to my sisters. I have 3 sisters, 2 older, 1 younger, and I was raised no differently than they were, and that definitely helped. And my mom told me right away, because of the fact that I'd already at the time when I was born had 2 older sisters. So obviously I was going to notice things that were going to be different. And when I was 9 months old, I wasn't sitting up, wasn't trying to roll over and do things that most babies would have probably been doing at about 9 months old. So I had like all kinds of people coming to the house, like a physical therapist, an occupational therapist. I believe that there was a special education teacher that came. So since I was little but not stupid, and as soon as I was old enough to understand a bit more, because from 9 months old until I went to preschool, these people would come to the house to work with me. And so my mom definitely knew that I would ask questions, because that's the kind of kid I was. Like, I would have been like, why? Like, why do these people come to see me but not my big sisters, you know? And obviously my 2 older sisters were going to go through puberty. And eventually when my younger sister was born, she was eventually going to go through puberty. So obviously I would have noticed those kinds of things. And so she told me. And I'm glad, because there was no big, huge, since it just became like a normal part of my life, it was no big, huge mystery, you know? Like, I kind of had the time to process it and accept it, which was great for me, because I definitely would recommend for moms of daughters with Turner syndrome, definitely tell them ASAP, like as soon as it's reasonably possible, because I know that one of the big struggles that many females with Turner syndrome have is just being able to accept it, because of all the stuff that comes with it. Because there are a lot of health issues. There's heart problems, which I have a bicuspid aortic valve, high blood pressure, high cholesterol. I have a horseshoe or conjoined kidney, scoliosis, rotation of the hip. At least that's one. I had an x-ray for my back like some time ago, because it had been hurting me, bugging me. I brought it up at a doctor's appointment, and the doctor was like, well, we could do an x-ray and like see what's up. And that was, I guess, the results of those x-rays. I don't know, I haven't had one done in like a long time again, so I'm not like really sure like what the state of that is at the moment. But I did but the results were a mild case of scoliosis and rotation of the hip, if memory serves me right. So there's that, because skeletal issues are definitely one of the problems that can come along with having Turner syndrome. Like, I have an underactive thyroid. I take like at least 6 different types of medication to help deal with the health issues that I have, because I also have type 2 diabetes. That's something to look out for, definitely. I have hearing aids because I had like a bunch of ear infections, which is one of the things that can be a common thing with Turner syndrome. A lot of girls with Turner syndrome, when I've noticed, at least for me, when I was younger, it was more of a problem with getting chronic ear infections. As I started getting a bit older, they didn't happen as much or very often anymore. But I definitely had chronic ear infections as a kid. Constantly was in and out of the doctor's office with them for a long time, to the point where the doctors already kind of knew what I was in there for, and I already kind of knew what to expect. Had a whole routine down. Like, I knew what to do. So that was how often it was. Some of them would get pretty bad because I was so used to having the ear infections, that the doctor believed that, like, when most people would notice like a little twang of like pain or something, most people would notice that. But since I had them like so often, that little bit of a feeling of, oh, like ear infections coming out, like I didn't notice it until the ear infection would become like full blown and like really painful. So hearing loss is something that you kind of have to watch out for with Turner syndrome. Lots of things. So it can be a struggle. Like, it's a lot to deal with. Like, it's kind of crazy to think that one small little genetic fluke, like the partial deletion or total deletion of a chromosome, could throw everything off. It's kind of crazy. I mean, the body works in mysterious ways, I guess. But it is what it is. Like, I just deal with what I have to deal with, like, one step at a time. That's the best. I feel like that's the best way to go about it. Like, I can imagine when I was younger, like, how tough it must have been, like, for my mom and stuff. And, like, I didn't even have to go through growth hormones, which is, like, one of the treatments that you often go through to help with the height. Usually you can get like a few inches with the growth hormones, but we didn't go that route because I couldn't really see a bunch of specialists and stuff as a kid, because we lived in such a small town that specialists were hard to come by, not to mention the fact that neither one of my parents drove, so there was no real way to get to doctors unless somebody was willing to help you out and take you. And then when I moved to where I am now, again, my mom didn't drive, still doesn't drive, and there was like no real way to be able to go see specialists. I didn't really start seeing anybody until I was already in high school. I was like maybe 18 years old when I finally started hormone replacement therapies to basically kickstart puberty. Normally you would start hormone replacement therapy at around 12, 13-ish, depending upon what the doctors think. But I didn't start until I was already like a senior in high school. Because again, it was kind of tough to really be able to see or talk to anybody about Turner syndrome, because it's not like a widely known thing. I mean, Turner syndrome's kind of rare in the fact that it affects like 1 out of like every 2,000 like live female births. I mean, it would be like, studies have shown that like 90-something% of miscarriages are like usually fetuses that would have been born with Turner syndrome, from what I'm to understand. So it's kind of a miracle to be one of the 1% that made it, because many fetuses that would have been baby girls born with Turner syndrome usually get miscarried. So that's kind of like, wow. and it's tough. Like, it's it's crazy, you know, to think the fact that, like, that something so small, like I said, something so small like that could have a huge impact on a person's body. And it's just one of those things that, for me, I just had to deal with it, you know? Took one day at a time. I'm kind of glad that my mom told me as young as she did, because it definitely made it easy. And there's all kinds of information, like there's definitely like a lot more resources out there now compared to what there used to be, which is a good thing, because like I was born in 86, and at that time, I mean, there's definitely was very little known back then compared to now even. So that was like really, I can imagine for how scary it probably was for my mom. Like, I remember her telling me that when the doctor first explained to her that I had Turner syndrome, first question out of her mouth was, is it going to kill her? And the answer to that was no. Turner syndrome is not going to kill you. Where the issue comes in is with the health issues. But Turner syndrome in itself, like, is not a death sentence. So I highly recommend keeping up on the various health issues and stuff. But yeah, this is just like my little introductory video to talk about Turner syndrome. So if anybody's interested in wanting to learn more, have any questions, would like to see more videos, you can comment, like, subscribe. Let me know if there's anything specific, because I mean, there's a lot. Like, definitely get into this. I plan on making more videos, definitely, because there's so much to talk about. Anyways, that's it, guys. Bye.